8 blood clot symptoms that can save your life. Most people believe blood clots only happen to the elderly, to hospital patients lying in bed for weeks, or to people on long international flights. That belief is false, and it is a dangerous one, because blood clots can form in a person of almost any age, in a person who exercises daily, and in a person who has never spent a single night in a hospital. This video is for educational purposes only. It is not intended to diagnose any condition, recommend any treatment, or replace the guidance of a qualified healthcare professional. If you are ever concerned about your health, please consult a doctor or other licensed medical provider. Here is something worth sitting with for a moment. A blood clot can form quietly, without pain, without warning, and without a single obvious symptom, and then travel to the lungs within hours. That single fact is why so many people miss the early signs until it is almost too late. Throughout this video, we will walk through 8 of the signs that medical professionals say deserve attention, moving from the ones people tend to recognize to the ones that are far easier to miss. One of these signs, the one many people describe as the one they wish someone had told them about sooner, is coming later in the video, so stay with us. Before we go further, let's talk briefly about what a blood clot actually is, in plain language. Blood is supposed to flow smoothly through your veins and arteries, carrying oxygen and nutrients throughout your body. When you get a cut, your blood has a natural ability to thicken and form a clot at the site of the injury, which is a normal and helpful process that stops bleeding. The problem begins when a clot forms somewhere it should not, inside a vein where blood flow has slowed down or become disrupted, often deep inside the leg. This is sometimes called deep vein thrombosis, a medical term that simply means a blood clot has formed in a deep vein, usually in the calf or thigh. On its own, this may cause swelling and discomfort. The real danger comes if a piece of that clot breaks free and travels through the bloodstream to the lungs, a condition called pulmonary embolism, which means a blood vessel in the lungs has become blocked. This is considered a medical emergency, and it is one of the reasons doctors urge people to take even mild, unusual symptoms seriously. It also helps to understand why clots tend to form in the first place, because the reasons are more ordinary than most people expect. Doctors often describe 3 general conditions that raise the likelihood of clot formation, sometimes referred to together as a triad. The first is slowed blood flow, which can happen when a person sits still for an extended period, whether that is during a long flight, a long car trip, or an extended hospital stay. The second is damage to the inner lining of a blood vessel, which can result from surgery, injury, or even certain medical procedures. The third is a change in the blood itself that makes it more prone to clotting, which can be influenced by genetics, hormones, certain illnesses, or dehydration. None of these conditions alone guarantees a clot will form, but understanding them helps explain why clots are not random events. They tend to follow patterns, and once you understand the patterns, the 8 signs we are about to cover start to make a lot more sense. Number 1, swelling in one leg that seems to come out of nowhere. This is often the very first sign people notice, and it is also one of the most frequently dismissed. The swelling tends to be different from the kind you might get after a long day on your feet, because it usually shows up in only one leg rather than both, and it often does not improve with rest or elevation the way ordinary swelling might. Doctors describe this pattern as asymmetrical swelling, meaning one side of the body looks noticeably different from the other. Consider the story of Linda, a 62-year-old retired schoolteacher who noticed her right ankle looked puffier than her left one after a weekend of gardening. She assumed she had simply overdone it and iced the area for 2 days. When the swelling did not go down and her calf began to feel unusually tight, she mentioned it to her daughter, who encouraged her to see a doctor the same afternoon. It turned out to be a deep vein thrombosis, caught early enough to be treated before it became more serious. Stories like this are a reminder that swelling limited to one leg, especially when it appears suddenly and does not respond to typical home remedies, may be worth discussing with a healthcare provider rather than waiting to see if it resolves on its own. One helpful way to think about it is proportion. Ordinary swelling from a long day of standing tends to affect both legs somewhat evenly and improves with rest, elevation, and a good night of sleep. Swelling that favors one leg over the other, that feels tight or heavy rather than merely puffy, and that lingers into a second or third day is behaving differently, and that difference in behavior is often more meaningful than the swelling itself. Number 2, a feeling of warmth in a specific area of the leg. Many people expect a blood clot to feel cold or numb, but in reality, the opposite is often true. When a clot disrupts normal blood flow, the surrounding tissue can become inflamed, and inflammation tends to produce heat. This means a patch of skin on the calf or thigh may feel noticeably warmer to the touch than the skin around it, almost as if there were a low-grade fever concentrated in just that one spot. This localized warmth is different from the general warmth you might feel after exercise, because it tends to stay in one place and does not fade as your body cools down. It is easy to brush this off as a pulled muscle or a minor strain, especially in people who are physically active. Consider David, a 36-year-old marathon runner who noticed one calf felt distinctly warmer than the other during his usual evening stretch routine. He assumed it was simply a minor strain from an increase in his training mileage and continued running for another 3 days. When the warmth persisted and a dull ache developed underneath it, a friend who worked as a physical therapist urged him to get it checked rather than pushing through the discomfort. It turned out to be an early clot, caught before it had the chance to travel anywhere else in his body. David later said that, as an athlete, he had been trained to run through minor pain, and that mindset nearly caused him to overlook a genuine warning sign. When warmth appears alongside swelling or unusual tightness, it may be a combination worth mentioning to a doctor, since together these signs can point toward a vein that is not functioning the way it should. Number 3, skin that changes color, appearing red, purple, or unusually pale. Skin discoloration is one of those symptoms that people often notice right away, but explain away just as quickly. A reddish or purplish tint along a vein, sometimes described as looking like a bruise that appeared without any injury, can be an important clue. In some cases, the skin may instead take on a pale or slightly bluish tone, which can indicate that blood flow to that area has been reduced. Think of James, a 45-year-old truck driver who spent long hours behind the wheel for his job. He noticed a strange purple discoloration along his lower left leg that he assumed was from bumping into something during a delivery, even though he could not remember an injury that would explain it. The color did not fade over several days the way a typical bruise would, and when he finally brought it up during a routine checkup, his doctor ordered an ultrasound that confirmed a clot. James later said that if he had not mentioned it almost as an afterthought, it might have gone unnoticed for weeks. Unexplained discoloration, particularly when it lingers rather than fading like an ordinary bruise, is a detail that may be worth raising with a medical professional. Number 4, pain or tenderness that feels like a cramp but will not go away. Muscle cramps are common, especially after exercise, dehydration, or sitting in one position for too long. What makes clot-related pain different is how persistent it tends to be. Rather than easing up with stretching, massage, or a change in position, the discomfort often lingers for hours or even days, and it may worsen when standing or walking. Some people describe it as a deep, throbbing ache in the calf, almost like a Charlie horse that refuses to release. Doctors sometimes use a simple test during examination, gently flexing the foot upward to see if it triggers pain in the calf, though this should always be assessed by a professional rather than attempted as a form of self-diagnosis. If a cramp-like sensation continues well beyond what would be expected from normal muscle fatigue, and especially if it is paired with any of the other signs mentioned so far, it may be a signal that something more than a simple cramp is happening beneath the surface. It is worth noting that stretching often makes an ordinary cramp feel better almost immediately, while clot-related discomfort typically does not respond to stretching in the same way, and in some cases may even feel slightly worse with certain movements. That single difference in response to stretching is a detail many people overlook. Yet it is one that healthcare providers often ask about directly during an evaluation. Before we move to the next sign, it is worth pausing to notice a pattern. Each of these symptoms on its own can look like something ordinary: a bruise, a cramp, a bit of swelling after a long day. The real value in understanding these signs comes from recognizing them together, because clots rarely announce themselves with a single dramatic symptom. They tend to whisper before they shout, which is exactly why the next few signs are so important to understand. Number 5, shortness of breath that appears suddenly, even at rest. This is where the conversation shifts from the leg to the chest, and it is also where things become more urgent. If a clot breaks loose from a vein and travels to the lungs, one of the earliest signs can be a sudden difficulty catching your breath, even while sitting still or lying down. This is different from the breathlessness you might feel after climbing a flight of stairs, because it often comes on without any physical exertion at all. Some people describe it as feeling like they cannot get a full, satisfying breath no matter how hard they try. Consider the experience of Robert, a 58-year-old accountant who had just returned from a 12-hour international flight. 2 days later, while sitting at his desk, he suddenly felt winded, as though he had just sprinted up several flights of stairs, despite not having moved from his chair. He initially wondered if it was anxiety related to a stressful work deadline. When the sensation did not pass after 20 minutes and he began to feel lightheaded, his wife insisted they go to the emergency room, where doctors identified a pulmonary embolism. Sudden, unexplained shortness of breath, particularly following a long period of immobility such as travel or bed rest, is considered by many medical professionals to be a symptom that warrants immediate evaluation rather than a wait-and-see approach. Number 6, chest pain that sharpens when you take a deep breath or cough. Chest pain, understandably, makes people think of the heart, and while that concern is valid and should always be taken seriously, there is a specific pattern associated with clots that travel to the lungs. This type of pain often feels sharp rather than dull or crushing, and it tends to intensify specifically when breathing in deeply, coughing, or laughing. Some people describe it as a stabbing sensation on one side of the chest that eases slightly when they stay very still. This is sometimes referred to as pleuritic chest pain, a term that simply describes pain related to the lining around the lungs. Because chest pain can indicate several different serious conditions, it should never be assumed to be one thing or another without proper medical evaluation. If chest pain of the sharp, breath-related nature occurs, especially alongside shortness of breath, calling emergency services immediately is strongly advised. In the United States, that means calling 911 without delay, rather than attempting to drive yourself to a hospital or waiting to see if the pain subsides. Every minute matters in these situations, and emergency responders are trained to begin evaluation and treatment on the way to the hospital, which can make a meaningful difference in outcomes compared to arriving on your own. Number 7, a rapid or irregular heartbeat without an obvious cause. When a clot restricts blood flow to the lungs, the heart often has to work harder to compensate, which can cause the heartbeat to speed up or feel irregular. This might feel like your heart is fluttering, racing, or pounding noticeably in your chest, even though you have not been exercising or feeling particularly anxious. Some people notice this sensation while simply sitting at a desk or lying in bed at night. A racing heartbeat has many possible explanations, ranging from caffeine intake to stress to underlying heart conditions, which is exactly why it should always be evaluated by a professional rather than self-diagnosed. However, when an unexplained rapid heartbeat appears together with shortness of breath or chest discomfort, medical professionals often consider this combination significant enough to warrant urgent attention, since it may reflect the body's response to a blockage affecting normal blood flow to the lungs. Number 8, a persistent cough, sometimes bringing up blood, along with unexplained fatigue. This is the sign that many people say they wish they had understood sooner, because it is so easily mistaken for a common cold, seasonal allergies, or simple exhaustion from a busy week. A dry, nagging cough that does not respond to typical remedies, particularly one that develops alongside the other symptoms already discussed, can be an important indicator that a clot has reached the lungs. In some cases, this cough may bring up small amounts of blood, a symptom that should never be ignored under any circumstances. Alongside the cough, many people report an overwhelming sense of fatigue that feels disproportionate to their normal daily activities, a tiredness that rest does not seem to fix. Margaret, a 71-year-old grandmother recovering from knee surgery, described feeling unusually drained for nearly a week, along with a cough she attributed to a lingering cold. It was only when she noticed a small amount of blood while coughing that her family rushed her to the emergency room, where she was diagnosed and treated in time. In the days leading up to her diagnosis, Margaret told her daughter she felt like she was moving through the day underwater, needing to sit down after simple tasks that had never bothered her before, like folding laundry or walking to the mailbox. She attributed this entirely to her recent surgery and the natural process of healing, which made the eventual diagnosis feel especially surprising to her family, since nothing about her fatigue seemed dramatic or alarming in the moment. Her story is often shared by clot survivor support groups, precisely because the combination of a persistent cough and unexplained exhaustion is so frequently mistaken for something far less serious. If a cough lingers without a clear cause, especially following surgery, injury, or a long period of reduced movement, and is joined by fatigue that does not improve with rest, seeking medical evaluation promptly is considered by many healthcare professionals to be an important and potentially life-saving step. Understanding these 8 signs is valuable, but it also helps to know who tends to be at greater risk, since certain circumstances can make clot formation more likely. Extended periods of immobility, such as long flights, long car rides, or bed rest after surgery, may slow blood flow in the legs. Certain medications, including some hormonal treatments, have been associated with increased risk in some individuals. Pregnancy, recent surgery, obesity, smoking, and certain inherited conditions affecting blood clotting can also play a role. None of these factors guarantee that a clot will form, and having one or more of these risk factors does not mean a person will experience any of the symptoms described in this video. Risk factors simply mean it may be worth paying closer attention to your body and discussing your individual situation with a healthcare provider, especially before or after a long period of travel or reduced activity. There are also a few simple habits that healthcare providers frequently mention as potentially helpful for supporting healthy circulation, particularly during periods of prolonged sitting. Standing up and walking for a few minutes every hour or two during a long flight or car ride is one commonly mentioned habit. Staying well hydrated, since dehydrated blood can become thicker, is another. Some people find gentle ankle circles and calf raises helpful while seated for extended periods, as these movements can encourage blood flow in the lower legs. None of these habits are guaranteed to prevent a clot from forming, and they are not a substitute for medical advice tailored to your individual risk factors, but they are commonly discussed as reasonable, low-risk practices worth considering, especially around travel or recovery from surgery. It is natural to wonder what happens after someone raises these concerns with a doctor. In general, a healthcare provider may begin with a physical examination and ask about recent travel, surgery, family history, and the specific nature of the symptoms. From there, imaging such as an ultrasound of the leg or specialized scans of the chest may be used to look for a clot directly, since these signs alone cannot confirm a diagnosis without proper testing. If a clot is identified, treatment decisions are made individually by a medical team based on the specific situation, and outcomes are often described as considerably better when a clot is identified and addressed early, which is precisely why understanding these 8 signs and acting on them promptly can be so meaningful. It is also worth addressing a common misconception directly. Many people assume that if a clot were truly dangerous, the pain would be unbearable and impossible to miss. In reality, research has suggested that a meaningful percentage of blood clots, particularly early deep vein thrombosis, produce mild or even minimal symptoms at first. This is part of why public health researchers describe blood clots as one of the most underdiagnosed serious medical conditions, since the early warning signs are frequently subtle enough to be dismissed as ordinary aches, minor bruises, or everyday tiredness. Another misconception worth addressing is the idea that blood clots are something that only happen once and then never again. In reality, some people who have experienced a clot in the past may have an increased likelihood of experiencing another one, which is why doctors often ask new patients whether they or a close family member have any prior history of clotting issues. This is not meant to cause alarm, but rather to highlight why an accurate personal and family health history can be such a valuable tool. Simply knowing your own history and sharing it honestly with a healthcare provider can shape how carefully certain symptoms are evaluated going forward. It is also worth mentioning that age alone should never be used to rule a clot in or out. While the likelihood of developing a clot does tend to increase with age, clots have been documented in teenagers, in young athletes, in new parents shortly after childbirth, and in otherwise healthy adults in their 20s and 30s. This is part of why awareness matters for every viewer of this video, regardless of age, activity level, or general health status. The 8 signs discussed today are not exclusive to any particular group of people, and treating them as universally relevant, rather than something that only applies to someone else, is one of the simplest ways to protect yourself and the people you care about. As we bring this video to a close, let's return to where we started. The false belief that blood clots only happen to the elderly, the hospitalized, or the immobile has likely caused countless people to overlook symptoms in themselves or in someone they love. The truth is that awareness of these 8 signs, sudden one-sided leg swelling, localized warmth, unexplained skin discoloration, persistent cramp-like pain, sudden shortness of breath, sharp breath-related chest pain, an unexplained rapid heartbeat, and a persistent cough paired with fatigue, may be one of the simplest and most powerful tools available for protecting yourself and the people around you. It is worth remembering the statistic mentioned earlier in this video, that a meaningful percentage of early blood clots produce only mild or minimal symptoms, which is exactly why recognizing even the smallest of these signs matters so much. Think back for a moment to Linda's swollen ankle, David's warm calf during an evening stretch, James's unexplained bruise, Robert's sudden breathlessness after a long flight, and Margaret's persistent cough that turned out to be so much more than a lingering cold. None of these people ignored their bodies out of carelessness. They simply did what most of us do every day, explaining away a strange sensation with the most ordinary reason available, because that is human nature, and because most of the time, ordinary explanations really are correct. The difference in each of these stories was a single moment of paying closer attention, asking one more question, and choosing not to wait. That is really what this video has been about from the beginning, not fear, but attention. The kind of attention that allows you to notice when something in your body is behaving just a little differently than usual, and the confidence to take that difference seriously. If you or someone you love has ever experienced a moment where a small, easily dismissed symptom turned out to be something more significant, we would genuinely love to hear about it in the comments below, since sharing these stories may help someone else recognize the same signs in time. If this video helped you understand something new today, please consider sharing it with a friend or family member who might benefit from knowing these 8 signs. And if you would like to see more educational content like this in the future, subscribing helps this channel continue creating videos designed to keep you and your loved ones informed. Thank you so much for watching, and we will see you in the next video.